Good evening, everyone, and thank you for tuning in to our latest Ask the Leaders Facebook Live Q&A. I'm Darryl Smalley, and I'm the Executive Member for Culture, Leisure and Communities at City of York Council. Some of you might already know that the Council has held a number of Facebook Live sessions now, covering a wide range of topics from the latest public health advice to the gradual reopening of the city. Yesterday, we heard more from the Council's public health team on the new 3-tiered restriction system, and that recording is available on the Council's Facebook page, but also on their YouTube page as well. So do, if you want to, do have a look at that. Today, we're delighted to be joined by representatives of the city's universities and colleges to discuss the ongoing work done to keep students, residents, and our city safe. We'll be taking your questions on the safe return of students to the city's unis and colleges, the ongoing response to coronavirus, and how you can support York's collective effort to protect those we love and keep the places we enjoy open. Before I go on and let the panel introduce themselves, I'd just like to take a quick minute to highlight the ongoing work between the city's public health teams and the university and college leaders and staff, who have all gone above and beyond to ensure that students could return to York safely. I'm sure we'll hear more about this and the work that's gone into making sure safety measures and the support that's available later in the session. As we will all appreciate, the last few months have been incredibly difficult for us all, and that absolutely includes students who have had to adjust to new and unprecedented university and college experiences. Having myself only been a student quite recently, I can only imagine how different this year must feel. Despite this challenge, we've seen students alongside other residents and businesses do their bit to protect our city and each other. Unfortunately, COVID-19 infection rates in the city, like the region and like the nation, are rising, and we've seen in other areas of the country and around the world that shows we can't be complacent. We'll hear more about the very latest data from Sharon in just a few minutes, but as been said plenty of times in the last few days and week, we must all remain vigilant and work together to keep our city safe and each other safe. Now I'll stop there and just go round. I'm aware we all look different on Zoom to each other, so I'll read your names out, and if you could just briefly introduce yourself. We'll go first with Karen.
Good evening, I'm Karen Bryan, Vice-Chancellor of York St John University.
Thank you very much. Patrick.
Thanks. Good evening, everybody. My name is Patrick O'Donnell and I'm President of University of York Students' Union.
Thanks very much. Sharon.
Hello, everyone. My name is Sharon Stoltz and I'm the Director of Public Health for City of York.
Thank you very much. Charlie.
Hi there, I'm Charlie Jeffery, Vice-Chancellor of the University of York.
Thank you. Louise.
Good evening, my name's Louise Doswell and I'm Deputy Chief Executive and Principal of York College.
Thank you very much. And last but not least, Purnur.
Hello everyone, my name is Purnur Altay. I am the President of the York Graduate Students Association.
Thank you very much. Well, firstly, then we'll just go to a few questions. In fact, before we go to the questions, could we please go to the public health update from Sharon, and then we'll get straight into the answers, into the questions that were given and submitted beforehand, and we'll also keep an eye out for all your live questions and feed those into this evening as well. Over to you, Sharon.
Thank you, Darryl. I'm not going to go through the data in as much detail as I did last night, because I'm conscious that we have a lot of questions that have come through this evening. For anyone who does want to see the detail behind some of what I'm going to say, all of our data is published on the York Open Data platform. If you Google York Open Data, you'll actually find the link to that information. So what I'd like to start off by saying is that we, myself and my team, together with colleagues in business intelligence within the council, review what's happening with our case data on a daily basis. the information that you see tweeted from the council may be different to the data that you can find published in the general media, including the BBC web pages, for example, where you can type in your postcode and the rate of cases come up. And that's because locally we have access to what in public health we call unvalidated data. So this is the data that we have access to locally that isn't yet in the public domain. And that's the information that we tweet on a daily basis, so that we're able to give residents and other interested parties and the most recent figures that we have. The caveat that we always give with our local data is that there's sometimes a time lag with data coming through, and so our local figures are always subject to change. That's the only caveat around that, really. So when we look at our local data, then that shows us that over the last 7 days, so that's for the period 5th of October to the 11th of October, which is the latest period that we have data for, our rate of COVID cases per 100,000 population has gone up to 216.5. That is higher than the national rate, but lower than the regional rate. So even though we're following the same trend as other local authorities in the region, we know that there are some other local authorities in South Yorkshire and the West Midlands, for example, that have higher rates than York. Just to put that into some perspective, we've had 138 new cases of COVID go onto the system since yesterday. So that gives anyone watching some kind of indication of how quickly those numbers are rising. We also monitor how many tests are being undertaken by York residents, and how many of those are coming back as positive. So the number of cases coming back as positive has increased since yesterday. Yesterday it was 13.1% and it's gone up to 14.3% today. So that gives some indication as well of the fact that we're having more tests coming back as positive. We're also seeing an increase in patients being admitted into hospital. I've got unvalid data for that at the moment that I've seen for today. I think the number of patients in York Hospital with confirmed COVID has gone up to over 30 today, and I was quoting 24 yesterday. We're still seeing cases in care homes, and we're still seeing cases in schools as well. But those numbers are fairly well controlled, and we're not seeing the number of outbreaks in care homes and schools that some other areas are seeing. So as Daryl said at the start, we can't be complacent in York. Our numbers are going in the wrong direction. So I think opportunities like this, live Q&A sessions, which provide residents with an opportunity to put their questions through, are really, really important, so that we can start a city dialogue as to how we're going to work together to address that. And today we're focusing on universities and students, but there'll be opportunities in future Q&A sessions to cover other topics as well. So I'll stop at that point.
Thank you ever so much, Sharon. And yeah, if people could please just comment either on Facebook or on YouTube, and even if we don't get to your comment in today's session, the Council's communications team will follow up all the questions, and they might appear on a future live session as well. We'll move straight to the first question that was submitted in advance, which was all to do with Christmas. So a resident has asked, will students who are from high-risk areas be able to return home and back to York after Christmas? Will anything be done to protect others from transmission? Quite a broad sort of Christmas-related question. I'm aware things are still changing quite quickly, but perhaps somebody wouldn't mind jumping in just to cover. It's Charlie. Thank you very much.
Thank you very much, Daryl, and thanks for the question. Christmas is a special time when families like to be together, and there will be lots of movement around the country for families to be together, and not just of students. So one point I would make is that we're going to see lots of movement, and we need to plan carefully for that. This is an issue which has been in the news a little bit, and we had a confirmation in Parliament a couple of weeks ago, I can't remember the exact date, by Gavin Williamson, the Secretary of State for Education, that students would be able to return home for Christmas. And the universities we've been working with the Department for Education to think how this can most safely happen. With all sorts of plans within universities likely to be developed to manage departures and to organise, where necessary, periods of self-isolation for students in order to make the movements from different locations safe, whether that's self-isolation at the university or at the parental home. The very strong message that we have given to government is that this can most effectively be done with the most effective management of risk if the government increases testing capability to deploy in university settings. And we have certainly offered to be part of any experimental use of new technologies which are now being rolled out with different types of higher volume and quicker response testing. And we will continue to press government to give us that extra facility in order to make the risk of travel at Christmas time as limited as possible.
Thank you very much, Charlie. And I completely agree, I think, and thank you on behalf of the city almost for the offer of the university there to help in that regard, and additional testing capacity and more timely reporting of results, as well as the additional resource then to analyse that data. Is absolutely vital to as well to Christmas, but also to where we are today. Purnur, would you like to come in?
Thank you, Daryl. I think it's also important to acknowledge that we might see a higher number of students staying in York due to travel restrictions or student finances. So, for example, for international students, going back to their home countries is quite often not the option for holiday periods because they are writing their essays, and it's a time that they dedicate for their course requirements. Therefore, as student unions, we have started planning online events to keep students engaged over the Christmas period too, so that there are plenty of opportunities and also an opportunity to minimize mental health risks.
Thank you ever so much. Straight over to Karen.
Yes, just picking up on Purnur's point, every year most universities will have some students who remain in the residences over Christmas, so international students, but also students who've come from a care background who effectively live in the residences. So universities and colleges have lots of experience in how to look after those students, in the needs of those students, how to provide well-being effectively over a holiday period. So I think it's quite important to remember that there's a wealth of experience around managing students, student movement, students remaining in residences that we can bring to this unprecedented situation that we have this year. Thank you.
Thank you ever so much, Karen. And I'm sure that the students that are staying in York, I know an awful amount is going into making sure that York itself is the usual Christmasified and make sure that, you know, if people are staying here, then they do have a wonderful time, despite all the restrictions. Moving on, another question we've had in advance is all around students and the economy, and the resident has asked, our economy greatly benefits from university students, and yet the nature of their environments has the potential to increase COVID cases. How can we ensure unity and cohesiveness towards this demographic, and making sure this doesn't lead to an element of us and them, or the student problem mentality, which I think is partly exactly why we're here today. But straight over to Patrick.
Thanks. I think it's really important that we don't have an us and them attitude. We are in this together. And I think there have been some quite lazy statements, nationally about students, being responsible for the spread of coronavirus. And frankly, that's not true. Students, many students are involved in volunteering projects. They're working in supermarkets. They're working on the front line of response to keep, our city and wherever they come from in the UK or beyond safe. So I really think, it's not helpful to have a sort of us and them attitude, and we really need to recognise that the vast majority of students here at York, and I'm sure other institutions in the city, recognise, their responsibility to the local community, to keeping themselves safe, that, their housemates and their lecturers safe, and also their neighbours and the wider community safe. And that's the whole reason, we're working collaboratively with yourselves at the council, and across sort of different, whether it's first buses and across the city and other institutions and organisations, we're working all together to sort of get those messages home to our students and both to the wider community, and to demonstrate our commitment that when we work together and we come together, that's the most effective response to dealing with the pandemic.
Thank you very much, Patrick. Straight over to Purnur.
Thank you, Daryl. I definitely agree everything Patrick has just said. It's definitely a shame to see there are people trying to bring us and them narrative forward as students are following basically the governmental guidelines closely for both their personal safety and for the safety of their community. I think our local community is not being divided by this divisive approach, because we know since the first cases of COVID in York, student volunteers have been working diligently to help the York community over the last few months. And following a call for volunteers from council, the York residents show the same enthusiasm to help students too. I think we should celebrate that.
Completely agree. Thank you. Charlie, would you like to come in?
Thank you very much indeed. I think that's a really good question, and I appreciate the way in which it was posed, which was recognising that the challenges of the situation, but being positive towards students. And I have to say, the city of York has been great, and the City Council has been very, very clear that students are full members of the local community and need to be viewed as such. And I'd also commend the local media, because I think the local media has been much more balanced on these issues than that in many other parts of the country. And I just wanted to stand back from that question for a moment. The UK government was clear that education should resume after lockdown, including university education, because this is about the opportunities for young people to develop their lives and build the platform for their individual future career prospects. But that's also a collective benefit for all of us. I think in the last meeting, I said this is about the doctors, the engineers, the scientists, the teachers, the lawyers of the future. And it is hugely important for us to be here as a university, providing those opportunities, working with our students so that in this very difficult situation, we see responsible behaviours. And I think that's exactly what we have seen. So I'm very pleased about that question, and it was good to hear our student president's response to it as well, because I think it says something not just about the contribution of students to the economy of the city, which is really, really important, but also to the social fabric of the city through those community-focused volunteering and other activities. And I'm very, very pleased that even in these difficult circumstances, our students are continuing to do that.
Thank you very much, Charlie, and completely agree there. Sharon, would you like to come in?
Yes, I just wanted to add a little bit of information, really. I receive emails from time to time from people who are expressing concerns that having students in the city is driving the increase in our COVID case numbers. I'd just like to say that that isn't entirely true. So my team works very closely with the colleges and the universities to monitor the numbers of students that are testing positive, the numbers that are needing to self-isolate as contacts. And even though it is true that when you look at the demographic of cases of COVID across the city, it's young people aged under 25 that we're seeing the largest number of cases. We estimate that only about half of those cases are actually students. And we're seeing an increase in cases across all age groups. So I just think it's helpful to put that into perspective to anyone that's watching. And if the media want to quote that, it's just to reassure people that inevitably we're seeing cases in students. But it would be wrong to say that students are the cause, as the sole cause of an increase in our numbers. So I just wanted to put that information into the mix.
Thank you, Sharon. I think just I guess closing off this question, I agree with everything everyone said, really, in terms of just how much students bring to our city, as Charlie said, not just to the economy, but also to all of our communities, from volunteering, working, and then hopefully eventually living in our city long term. Students are always an integral part of how York is so special. And I think York is a welcoming and open city. And just a week ago, we were voted as one of the friendliest cities in the UK. I'm not quite sure who was voting in that, but I think we can all agree that York is incredibly friendly, and I hope we maintain that in the coming weeks and months. We are all in this together, and we need to remember that as we all work through to get through this. Moving on to another question. This is probably, sorry, Sharon, another one directly to you, but of course anyone can come in. And it's from Nathan in advance. And Nathan asks, should York be moved into Tier 2? How prepared are we? And is it a possibility that we could find ourselves in Tier 2 later down the line? So I'll go to Sharon first, but if anyone else wants to come in as well.
Okay, so there's always a possibility of moving into Tier 2. So for those listeners who may not be aware, the government announced whatever day it was, yesterday I think it was, the days seem to run into each other, is that they were moving England into 3 tiers of intervention for COVID. Tier 1 is medium risk, which is where the majority of local authorities are. Tier 2 was high risk, and then Tier 3 was very high risk. At the moment, it's only the Liverpool region that is in Tier 3, and there are a number of authorities, including neighbouring authorities in West Yorkshire, that have gone into Tier 2. I talked a little bit about this in the Q&A last night and explained that when the government, so it's a government decision what tier a local authority goes into. It's not a local decision. The government will be looking at the advice from public health experts on the case numbers, the hospital activity, the number of people being tested, the number of those tests that are coming back as positive. So all of that picture, the epidemiology that we call it, in terms of what's happening with cases, is considered alongside measures that might need to be put in place to halt the spread of cases, to protect the NHS, particularly in terms of whether hospital activity is increasing. But the government will also be balancing economic and political issues, and all of that goes into the mix, and then the government decides which tier a local authority goes in. Because York's figures are continuing to rise, there is every possibility that we might go into tier 2. We are prepared for that. We work as a city with all of our partners, including colleagues that are on this call, in terms of students, but we also work very well with the police, with the fire service, with our NHS colleagues, with employers locally, the business community. So the whole city works together to ensure that we're communicating well, that we're identifying where our risks are, that we're putting in place the right measures to be able to respond and keep residents safe. So we obviously hope that we would stay in tier 1, but if we go into tier 2, we are prepared for that certainly.
Thank you very so much, Sharon, and thank you for giving some of the detail behind what quite goes on with the new tier system. We've got a lovely open question next. I think it's probably suitable in one way or another for everyone. And it is, how has the university or college experience changed in this first term? Aware we've only got sort of just over half an hour, and this will be documented for many years to come. But I guess who would like to come in on this quite broad question? Yeah, Louise.
Yeah, hi. I think for our students, the biggest change for them is when they walk through the front door and they see yellow and black tape on the floors and directional arrows and signage, trying to continue the education about COVID and how it spread and how they need to follow the safety measures, and hand sanitizer everywhere, and social distancing. So for our students, I think that for those that have come for the first time, very similar to the first year of university, that joy and that release of coming into an adult environment and being able to dress differently and behave differently, I think has probably been suppressed because of the face coverings they have to wear and the continual reminder of social distancing. But that's not to say they're not having a good educational experience. But as a college, we made a strategic decision we wouldn't bring all our students back in, so that we could keep the numbers low and we could manage any issues in terms of outbreaks. So what we've done is we've put a revised timetable in place where our students have half of their education within the building and half of that is self-directed study or online activities similar to this Zoom meeting. So I think for our students, our new students, it's not any different, but for our returning students, it's been a very interesting journey for them to try and adapt to the modifications in the building and the modifications in their learning.
Thank you so much, Louise. Charlie.
Thanks. I think we can echo much of that. Things do look very different from normal. We have moved significantly over half of our teaching to online settings, and lots of thought has been put into that to make that as effective as possible. And the signs are that students are really engaging very positively with that different way of communicating the subjects that they're studying. Where we have teaching on campus, it's as Louise described. It's with hand sanitizers absolutely everywhere, spacing, carefully organised one-way systems where our corridors are too narrow for people to pass each other within distancing rules, spaced out seating in our teaching rooms, additional ventilation. So a very, very different educational setting. At the same time, we are trying to maintain other aspects of on-campus life. So we have a number of social venues that we're running, and I'll probably ask Patrick to say a little bit more about those, because he's been pretty much the mastermind of them, which I think are probably the safest place in York to go for a drink. Perhaps I shouldn't announce that in a public meeting, because you may be inundated, Patrick, but very, very careful preparations and mitigations to limit the risk of transmission. And we're also, through our two students' unions, working very hard to make sure that some of the social activities, the clubs and societies and the sports activities that we would normally run, can run in limited form, with all the rules that we have to conform to. And I think that's really, really important for making sure that some of that rounded experience that students have always had from universities is maintained even in these difficult conditions, because that's not just it's not just an educational experience, it's a much wider experience, and we need to think very, very hard about student well-being. So it looks very different, but we are trying to recreate as much as we can in a safe way as possible.
Yeah, thank you so much, Charlie. Just before bringing Patrick, I see Karen's wanting to come in as well, so I'll go to Karen and then to Patrick.
Yeah, really just to echo what others have said, the campus looks very different. One-way systems, use of screening, hand wash, less furniture so that people can move around safely. We're asking people to wear face coverings indoors wherever they can't be 2 meters socially distant. We're finding that our students are adapting very well to how campus looks and complying incredibly well with what we're asking them to do, which I think is very reassuring. In terms of the educational delivery, so also blended learning, but all of our students have some learning on campus. There are also socially distant study facilities for them, and we have some very careful arrangements to book into specialist study facilities. So we hope that our students are having a really good experience. They're all coming into campus. They're very much feeding back that they appreciate some face-to-face contact. In terms of our support services, those are all available on campus or online so that students have some choice about how they access them, but all the normal support services are available. In terms of people's social life, making friends, having fun, obviously that is quite challenging at the moment, but students are really clever, really creative. So there are lots and lots of amazing examples of events that people are running online. And of course, there are also very small meetings and groupings of students. Our students are still very involved in volunteering. They're still going out to placements, for example. Students who are learning to be school teachers are still going to into schools, and our health students are going into hospitals and community clinics. So I think it's quite important to sort of look at that rounded experience that they're having. We're also working very closely with our student union so that we're addressing any issues that come up through the student body. Thank you.
Thank you so much, Karen. It's great to hear just what's going on into making it a good experience for students. Patrick, do you want to come in on a bit of what Charlie was saying earlier?
Thanks. So yeah, as both Karen and Charlie have outlined, we've had to change our sort of teaching and learning spaces quite a bit. And we've also changed our social spaces and places for students to hang out, because we recognise we have to provide spaces on campus, and we're actively discouraging students from going into the city centre. And we've created a series of marquees. We're lucky here at York to have a really green campus with loads of space, so we're really utilising that space and facilitating with a series of outdoor bars and things like that, where our volunteering projects can meet up and where our student groups can meet up and obviously we can have a series of activities and fun sort of social time, but obviously do that really, really safely. And as Charlie touched on, these spaces are, safer than the average venue in town because we do temperature checks on arrival. There's a rigorous track and trace process, which is linked to university data as well. So we've got really rigorous processes in place. And, from my conversation with students, and I'm sure it's the same for Purnur as well, the vast majority of students are, following those restrictions, are really, are appreciative of the changes that universities have made. And as Karen has alluded to, as a students' union, in both universities, we're working really closely with university management to make sure we get the approach right.
Thank you so much. I know just from seeing some of the photos how much has changed so quickly over summer. I remember from my time when there was a riot almost when the cider was changed, and just seeing how much has changed over summer. It's amazing just how much work has gone into it. Next, we've had a question live on Facebook, so going back to a sort of more public health focus. Jason has asked, Wales is imposing travel restrictions, and both Wales and Scotland are putting pressure on the UK government to impose travel restrictions on high case rate areas. Does this mean that there is a risk that some students will not be permitted to travel home from York, for example, for Christmas, if we're in tier 2 or 3 by then? Probably fairest to go to Sharon on this. Thank you.
Okay, so there shouldn't be any travel restrictions for students returning home within the UK. We already heard a discussion about obviously international students may be affected because of travel corridors, etc. But even in Liverpool, which is the only area where there are tier 3 restrictions at the moment, people are allowed to travel in and out of the area for essential journeys. And obviously a student going home for Christmas, I'm sure nobody would argue against that being an essential journey. So as local authorities find themselves in different tiers of restriction, undoubtedly people will be discouraged from making non-essential journeys both into those high-risk areas and out of those high-risk areas. But there's nothing in the guidelines at the moment that say that people can't go on holiday. So, if you're in a tier 3 area, you have a holiday booked, you're able to go to that, you still be able to travel to that holiday place. Whether they'll accept you, of course, is a different issue, but there are no restrictions to travel. And in the worst case scenario, we might go back to the travel restrictions that we had in lockdown over the summer, where people were allowed to travel for essential reasons, but not to go off on day trips and that kind of thing. And so we'll just have to keep an eye on what the government introduce in terms of regulations. But there are no kind of mandated travel restrictions at the moment.
Thank you ever so much. We've had a question in advance from Francis, who was essentially asking who is responsible for checking on students that have been told to isolate that they're actually doing so, which I'll also add in, I guess, what support is available for those students that are having to isolate. So it's a bit broader. I guess who would like to come in first on that item? Charlie, thank you. And then I'll go to Karen.
Thanks very much. Another good question. Thank you, Francis. This is one of the areas where I think we saw some challenges elsewhere in the country where perhaps some universities didn't get things quite right. We have been very much focused on what self-isolation means. Self-isolation is an act, a selfless act designed to protect others from a risk. And if people are being selfless, I think they should be supported. And that's been our attitude. And I'm sure Karen will say very much the same kind of thing. And that means, from our perspective, answering part of your question, being in touch with self-isolating students every day to understand how they're doing, whether they have any needs that haven't been met, whether they've got ill in a way that most younger people don't get ill, whether they need further medical attention. We've also put in place arrangements to ensure that any student in self-isolation has access to essential provisions and services. So food, prescriptions for those who need them, laundry services. Some of this has led us into new areas where we hadn't really thought of working as a university before. So we have established, with fantastic support from Morrison's, a hotline for self-isolating students off campus, those who we can't cater for so easily as those on campus, so that they can order and have delivered their essential provisions. On campus, we have 2 supermarkets. We're offering a similar facility at a lower scale, and are making sure that students not using that facility have food delivered to them in their settings. We're very concerned also about self-isolation as an emotional challenge. So we are making sure that students know of the online resources that are available to them to support their mental health and well-being, but also our on-site counsellors to whom they have access. And our students' unions, represented by Patrick and Purnur, have been wonderful through their various societies in putting on online activities, fun activities for students to engage in and pass the time when students are not studying in that self-isolation period. So I hope, Francis, that gives you some reassurance, both about compliance, and I think compliance with self-isolation is something that's likely to happen more fully with the support that we have put in place.
Thank you very much, Charlie. Straight over to Karen, and then we'll go to Purnur.
Thank you. Yes, just to add to that, I agree. I think asking someone to self-isolate for a period of time, be they a student or some other sort of citizen, it's a hard ask. So very much like University of York, York St John has made a decision to fully support those students. We have a COVID coordination centre which is open 7 days a week, 24 hours a day. As soon as any student is notified that they must isolate, we're in touch with them. We arrange twice daily calls, or more often if the student wishes, so that we can check how they're doing, check that if they're well, that they're continuing with their online learning as best they can. Similar arrangements to ensure that all of our students who are in self-catering accommodation can receive food. For example, our porters have been amazing in helping with prescriptions, waste disposal, all those practicalities which can become really problematic when you're self-isolating. Again, our student union and our societies are really helping with activities to keep people engaged. Our wellbeing services are available online, and we have some additional support packages to help students who are self-isolating. And we're also working with the student body to enhance that provision as best we can as we learn what helps students to comply with these periods of isolation. Thank you.
Thank you so much, Karen. Straight over now to Purnur.
Thank you very much, Daryl, and thank you for the question. Alongside what the university has already provided to support students, we are aware that the keeping students entertained is a big job that we need to fulfill for students in self-isolation. Actually, we have tested that with our Welcome and Network Weeks. So we hosted our first online Welcome and Network Weeks at the beginning during the September, and in 3 weeks we have provided 40 online events to engage students in an online way. We did this because most of our students, like the 60% of the postgraduate population at the University of York are international students, and not all of them are with us in York. So we want to welcome every University of York student, whether they are here in York or they are in their home countries. So in order to celebrate and bring those students together, we moved every activity we have been planning since May online, so that like we reach more students and not limit ourselves to the students who has already arrived to York. I think it has been proved to be both engaging and entertaining, and we will keep providing the same amount, like similar events, online provisions, to keep self-isolating students entertained.
Thank you so much, and it completely sort of jigsaws nicely into exactly what we're doing and everyone in the city is doing in terms of making sure that if you are at home, especially in the run up to winter months when it's less nice to be outside in your garden, that actually there are things available. So from press reader, so thousands of magazine titles available through the library service at Cllr, through to the York at Home website. If you just Google York at Home, then Visit York have done a great job of putting together, from the Castle Museum to the National Railway Museum to some of our performance venues, putting up where there are some fantastic things to watch and enjoy from the comfort of your sofa. We've had a few live questions come in. Sean, I'll pick that up quickly. So Sean asks, what's going on with the cones on Castle Mills just after the bridge? You'll be pleased to know, Sean, a paper was published on Monday, subject to an exec member decision session, which I think will be next week. The transport officers are recommending that the cones are removed, because although there has been obviously some benefit in that being there, I know we've seen from recently with traffic levels rising and especially bus journey times, that scheme isn't one that is recommended to go forward. But you can tune in. There'll be another live meeting when that will be discussed and decided on. And Lee, on the question of whether we'll be moving into a higher tier, we've been through that sort of at the start of this. So I don't know if you can on Facebook, but if you zoom back to probably 5 minutes into this, you'll hear Sharon give quite a good explanation on that. And I've just heard that on your second question on whether grandparents can provide childcare, we'll get back to you with a full answer on that as well. So moving on to another question in relation to this subject, and it's quite a big one, so we might not be able to cover it in all the detail necessary. But the question was, what plans are in place in case of a substantial outbreak? In case a substantial outbreak takes place in one of our universities or colleges. So I don't know who would quite like to come in on this first. Sort of don't all shout out at once. Charlie, there we go. Thank you so much.
Thank you. I think the way of looking at that question is to think about how we have been working across the city in the last weeks and months. So the two universities and the two colleges in the city are represented through me on the citywide coronavirus outbreak advisory board. And we run our own subcommittee of that board together with colleagues from Sharon's department. So we have been thinking through various scenarios, literally for months, and thinking through how we would respond to different situations. Through that, we collectively contribute to a public health assessment of the situation as is. We met on Tuesday morning, 8 a.m. This week. They all seem to be 8 a.m. These meetings to fit them around the rest of the working day, where we considered both the news nationally about the three-level system and the situation locally. And we came to the conclusion through that meeting, in a public health sense, we didn't at this point need to take additional measures. Now that could change, but that will be the forum of collaboration across the institutions and with the City Council Public Health team, where we would consider other kinds of measures and then through our various organisations implement them. What we found when we were doing various scenario exercises earlier in the summer, before the return of students, before York from the start of September began to see an increase in numbers, was that you cannot foresee the dynamics of a situation. So you have to look at every situation on its own merits. And that's precisely why we meet every week. I think I see Sharon rather more often than once a week these days. So we're constantly thinking about these issues. And Daryl, if I may, I didn't answer part of Francis's question, which was about testing. Testing is crucial. I was delighted that with the support of that group acting collectively, we persuaded the Department for Health and Social Care to accelerate the establishment of a walk-in testing centre in the city, available to students and the wider community. And we continue to work with Sharon's team to ensure that tests get to the right place at the right time. And I'm pleased to say that despite all the problems that we've heard about in the national system, in the last couple of weeks, we've seen the testing availability and the speed of response at a very good level. So apologies, Francis, for missing that in your earlier question.
Thank you ever so much, Charlie. And thank you for picking that up, and completely concur. I think I see Sharon on Zoom more often than some close family members. So thank you ever so much, Sharon, for all you do and on all the many meetings you attend for the good of the city. I'll just go on and have a look. So we did have a few final questions that were submitted in advance. One which is, what support, particularly mental health support, is in place for international students who have had to spend their first few weeks in York having to quarantine? So quite a specific one for international students there. Who would like to go first on this one? Oh, Karen, thank you.
Yes, just to say that our wellbeing services are available to all of our students, which would include our international students, but also our students who commute to university, our students who live in private accommodation, not university accommodation. So I think all universities made extensive preparations to receive those international students, to assist them with quarantine in exactly the same way as we described for our home students. But also we have experience of meeting the needs of international students. We have, for example, counsellors who would be very experienced in working with people who face a big challenge in coming to a new country, starting a new program. That's very challenging. So we've all been very aware of those issues and reaching out as much as we possibly can.
Thank you, Karen. Purnur, do you want to come in there, and then we'll go to Patrick?
Thank you. Yes, I definitely second Karen in terms of the difficulties international students might be facing because they move into another country. But what we provide at the University of York is like every student have an induction when they first arrive. So this basically provides them information about the university services. This range from well-being services and towards financial support too. So it covers a vast, broad range of services available to them. Also, like we provide in the department at the University of York, we provide a holistic approach to well-being. So we have an open door team who are available like until up to really late hours during term time. We have online platforms where students can seek help anonymously. We also provide both student unions provide independent and confidential support to students. So I think they're well being covered, and I think they know where to go when they need help through those inductions. Thank you.
Thank you ever so much. Patrick, do you want to go ahead?
Thanks. Yeah, just to add to the more formal sort of avenues for support in terms of wellbeing and mental health support, we're really showcasing all of our societies and our student groups, things like yoga that can easily be done online. And that really builds a sense of community. So it doesn't really matter where in the world you are, you can still, connect via Zoom, and through the online activities that our students are running. And, that's one really key thing. There's lots of informal ways that we can improve people's well-being and build that sense of community. So there's different layers to our approach, but we're absolutely, trying to involve as many people as we can to really build that sense of community and shared drive, really.
Thank you ever so much. Thank you ever so much, everyone, for those answers to those questions. Just on the live comments, Jojo Gray has just asked again about the popular or unpopular rather cones on Castle Mills Bridge. Did answer that earlier. There'll be a decision session, but the recommendation is that they'll be removed. So in the coming weeks, you might see those disappear. With an eye on time, aware that we've got 4 minutes until the end of this session, I'll just draw to a close, and I'd just like to say thank you to everyone who's asked a question today. I think we managed to get through almost all of them, and it's certainly valuable again to hear your views, and we'll continue to hold these Facebook Live Q&As on other important subjects, I'm sure education being one of them in the future. I'd like to thank our panelists this evening for giving up all their time and insight. And also just to say as well that it wasn't by design that we've had quite a good gender split on this panel. So thank you ever so much, and it's good to see that, because it too often isn't the case. I think just in summary then, I think remembering to keep ourselves and each other and our city safe. All residents have a key role in avoiding the need for future restrictions and slowing the spread of the virus. And remembering the 3 hands, face and space. Please feel free for anyone watching to continue to leave your comments and questions, and the Council's communications team will try to get back to you within the next 24 hours. Now, I'm sure we didn't cover all the topics, so if you are a student or a parent of any of the institutions represented here tonight, then I'm sure the relevant websites will have the best information. For future Q&A sessions, latest public health updates and more information on the topics we discussed today, please follow the Council social media pages and other online resources. But otherwise, I think I'll just leave it by saying thank you to everyone for joining us tonight, and I hope everyone has a great evening.